First tonight, hundreds of Butler Hospital union employees have agreed to go on strike to demand better working conditions. Good evening, I'm Shannon Heggie. If their demands aren't met, that strike could happen in a matter of weeks. 12 News reporter Alex Torres-Perez goes over what they're asking for and the latest in the ongoing negotiations.
Union workers essentially want two things: better pay and a safer work environment, as they say some employees are not only financially struggling, but scared to come to work. The clock is now ticking for Butler Hospital and Care New England to come to an agreement with the New England Healthcare Employees Union before the looming strike.
No one wants to strike for no reason. We have very serious issues. We want them solved, and we want the hospital to come to the table ready to solve those issues.
Daniel Camp has been working at Butler Hospital since he was a teenager and wants to continue working there until he grows old. But because of the low pay and high employee turnover rate, he says the job is not only becoming harder, but more dangerous too, with over 100 reported assaults in the first 3 months of 2025.
I've been thrown, on my back a couple times. Luckily I've never been injured, but some workers have not been so lucky. And I can completely understand, having that fear on the drive into work about, what's going to happen to me today.
On Monday, hundreds of workers picketed outside the hospital to call for an end to workplace violence and poverty wages. A spokesperson for Care New England says the new proposed 4-year contract offers a 15% to 32% total wage increase. They're proposing a new workplace violence prevention task force to review and offer ways to improve current protocols, training, and reporting procedures, saying they have no tolerance for violence at Butler Hospital. But Camp says they want more to be done.
So we don't feel that it's what they're doing is enough. Otherwise, we wouldn't have, these issues.
He's hopeful the hospital will take their demands seriously when they meet to bargain on Tuesday, not only for the workers, but for patients as well.
It's at the end of the day, it's about helping increase the quality of care that this community that we love, that we serve, that we're a part of, gets, and that we can provide to them.
If both sides can't come to an agreement Tuesday, the union will file a notice to strike, which would then take place at least 10 days later. Reporting in studio, I'm Alex Torres-Perez, 12 News.